trying to conceive? Understanding implantation bleeding could be crucial in recognizing early signs of pregnancy. This often overlooked phenomenon occurs in about 25% of pregnancies and can easily be mistaken for a period. Let's dive into what implantation bleeding is, how long it lasts, and how to distinguish it from other types of bleeding. Implantation bleeding happens when a fertilized egg attaches itself to the lining of the uterus. This process typically occurs 6 to 12 days after ovulation, with days 8 to 10 being the most common. As the embryo embeds itself, it may cause small blood vessels to break, resulting in light bleeding or spotting. So, how long does implantation bleeding last? For most women, it's a short-lived event. Typically, implantation bleeding lasts anywhere from 24 to 48 hours. However, in some cases, it may continue for up to 3 days. This brief duration is one of the key factors that sets it apart from a regular menstrual period. What does implantation bleeding look like? It's usually much lighter than a typical period. Most women experience just a bit of spotting. You might notice some pink, beige, brown, or even a few drops of red blood when you wipe. The color can vary, sometimes appearing pink, brown, or even black, indicating old blood. While some women might need a panty liner, many won't even notice it happening. Distinguishing implantation bleeding from a period can be tricky, especially if you typically have light periods. However, there are some key differences. Period bleeding usually starts heavy with red blood and gradually becomes lighter, lasting anywhere from 2 to 7 days. It's often accompanied by premenstrual symptoms like cramps, mood swings, and bloating. In contrast, implantation bleeding starts light and stays light, with no red blood. It typically goes away on its own within 24 to 48 hours and may be accompanied by light uterine cramps, swollen and painful breasts, or dizziness. While implantation bleeding is normal and common, it's important to note that not all bleeding during early pregnancy is harmless. Other causes of bleeding in early pregnancy can include low progesterone levels, subchorionic hematomas, or in more serious cases, ectopic pregnancies. These conditions often require medical attention, so it's crucial to consult with your doctor if you experience any unusual bleeding. Understanding the signs and symptoms of implantation bleeding can help you recognize early pregnancy. However, the only definitive way to confirm pregnancy is through a home pregnancy test or a visit to your doctor. Remember, your body starts producing the pregnancy hormone HCG from the moment of implantation, but it takes time for levels to become detectable. Monitoring changes in your body when trying to conceive can significantly improve your chances of getting and staying pregnant. If you experience any bleeding during early pregnancy or have concerns, don't hesitate to reach out to your healthcare provider. They can provide the guidance and support you need on your journey to parenthood.